We're roughly halfway through this course, and at this juncture we come to the topic which in some ways is the most difficult, I think emotionally the most difficult, a subject that's very complicated, very ultimately sad, which is what does stress have to do with cancer? Now what we saw in the last lecture, this whole world of psychoneuroimmunology, was a very simple prediction. Insofar as chronic stress can chronically suppress the immune system, if you are chronically stressed, there are all sorts of infectious diseases that you should now be more at risk of. And as we saw, that's absolutely the case for things like nose colds, for things like viral reactivation, herpes, cold sore flare-ups. What we approach in this talk is the most challenging one in this whole field. What does stress have to do with cancer? Now, in order to approach it, we need to spend a couple of minutes at the beginning here looking over what cancer is in order to see where stress impacts it. Cancer, in the broadest possible terms, cancer is a problem of uncontrolled growth. Cells that are growing much faster than they should, growing as tumors, cells that are growing at the wrong time, uncontrolled, inappropriate growth. Now, when in life do you have perfectly controlled, appropriate growth? It's during development. All you're about then is things growing, things developing. And there are all sorts of genes that regulate growth at different points during fetal life, childhood, all of that. And if everything goes right, somewhere around the points where a particular type of growth has gotten to where it's supposed to be, the relevant genes switch off. And ideally, they are now switched off for the rest of time. So what's cancer? Cancer is when there is accidental reactivation of those growth genes. Many years later in adulthood, cancer is activation of genes that have no business being active anymore. And technical term, and ignore it if you want, these genes, these growth genes which can reactivate and then cause cancer are called oncogenes. But the main point is that what cancer is about is accidental activation, turning the switch on at a point in life where the switch should not be on, resulting in uncontrolled growth in the worst places at the most inappropriate times. So what are the causes of cancers in humans? A whole bunch of the leading causes. One is radiation. One is carcinogens, xenobiotics, which are things out in the world that shouldn't be out there, various toxins. Food that is carcinogenic, food, for example, that has lots of oxygen radicals. Another major source of cancer are when you have mutations in those oncogenes where they turn on, again, when they're not supposed to. Another one is there's certain viruses that can cause cancers. These happen to be rather rare, and what you see is best evidence one of those viruses isn't enough. You have to have multiple hits. One oncogene mutation isn't enough. You have to have multiple hits. That's the basic picture of what cancer is about. Uncontrolled growth. What you get is an interesting transition in what the biology of cancer is, which is you have this early phase of uncontrolled growth, and that's all about those oncogene things that will determine if a cancer is growing successfully from the cancer standpoint. After a while, there transitions into a second stage, which is these tumors, by definition, are growing like mad at an abnormal rate at an abnormal time. They're hungry. They have very high metabolic rates, and after a while, as cancer progresses, the challenge for the cancer is not so much to activate growth, but to feed the cells. Highly, highly elevated metabolic rates. So one of the things you see with cancer as it progresses is this wild phenomenon, which is cancer cells, tumors, can give out signals which trigger the ingrowth of blood vessels, of capillaries, to supply more nutrients to the tumor, a process called angiogenesis. And a very exciting field of cancer therapeutics these days is the notion of finding angiogenesis inhibitors. If you got a growing tumor and you make it impossible for it to get a new source of energy, you're going to starve it away. So what are some of the classic defenses against cancer? Early phases are immune defenses. And we heard in the last lecture, one class of immune cells, natural killer cells, which can go after cancerous cells. There's factors released by immune cells, tumor necrosis factor, things of that sort. With any luck, they can spot a tumor when it's just beginning to be tumorous and wipe it out. So the early stage of defenses against cancer are these immune defenses. As the cancer transitions to that more mature stage, the one as just talked about, where the main thing the cancer is about is getting enough food to grow like crazy, some of the body's defenses are built around trying to starve that tumor. Okay, so that's a general, of course, highly simplified picture of what cancer is about. So now we transition to what stress does to the system. And all we have to do is have stayed awake during the last lecture, and you know the answer. We have the early phases of cancer defenses built around the immune system being active and doing what it's supposed to do. So if chronic stress is dramatically inhibiting the immune system, chronic stress should impair your defenses against cancer. QED, case closed. And it's not hard to construct a sequence there that seems irrefutable, which is lots of stress, and thus you suppress the immune system, and thus your defenses against cancer are impaired, and thus you're more at risk for cancer and tumors grow faster. Absolutely clear sequence: stress to bad immune system to bad defenses against cancer to uncontrolled cancer. Perfectly straightforward. Of course, it's going to turn out to be wildly unstraightforward as we begin to consider this subject. So what's going on? What's going on in terms of cancer progression? In terms of this simple prediction that lots of stress puts you more at risk for cancer? It's obvious how it works. It's very straightforward. Everybody knows how this works. Everybody knows that stress causes cancer. Stress causes cancer. Stress increases the risk of getting cancer. Stress, once you have cancer, makes tumors grow faster. Stress is more likely to cause cancer relapse. Everybody knows this. It's one of the most commonly held beliefs about how cancer biology works and how stress-related disease works, sufficiently so that some years ago, there was a paper published in the journal Psycho-Oncology, the interactions between psychology and the cancer process. This paper in 2001, where a bunch of women who had just gotten a very serious breast cancer diagnosis were asked something simple. So what do you think caused your cancer? And we saw a few minutes ago all sorts of possibilities: radiation, carcinogens, mutations, all of that. And by a wide margin, what was the most common answer? Stress. Stress caused my cancer. So we've got this deeply held belief here that stress can cause cancer. So now it's time for us, amid that picture, to start dissecting this belief. First off, what's going on with animals, experimental animals, the world in which you can understand cancer in its greatest detail, the experimental setting in a laboratory? What is found there? Yes, indeed, lots of stress, lots of glucocorticoids. They, of course, were inevitably going to come in on the scene. Lots of stress, lots of glucocorticoids increase the risk of cancer in laboratory animals. And once they have the cancer, what stress does is accelerate the progression of the tumor. And it's reasonably well understood how this works, involving immune defenses being impaired, involving some of those metabolic defenses being impaired. It's reasonably well understood. My lab, in fact, did some of that work some years ago. Perfectly straightforward. So we appear to have this slam dunk in the world of experimental laboratory research: stress and cancer, stress and cancer. They seem interlinked. So what about humans? What about humans in a broad way? And what we've got right off the bat here inevitably is a really complicated picture. Right off the bat, what we have is lots of reasons to pay no attention to those laboratory studies. for a very simple reason. What causes the cancer in these animal studies? For the most part, you can't sit around and have the 10% of your rats as they get older come down with spontaneous cancer. It's really hard to study that. What you do is you experimentally induce the cancer. What you do is take some cancerous cells and inject it into the lab rat, and cancer occurrence, what that's about is whether those cancerous cells take off as a tumor. What cancer progression is about is how fast that tumor grows then, and human cancers are, no surprise, not due to being injected with tumorous cells, as we heard already, viruses, pathogens, radiation, all of that. So immediately there's this disturbing issue as to whether any of the laboratory stuff with lab rats are in fact pertinent to human cancer. So now what we need to do is very carefully dissect what's actually going on. And this is a particularly tough field because, as noted already, lots of folks go into it with some beliefs about how things work, and it has taken some enormously obsessive, aggressively detailed-oriented research to try to pick apart this issue in humans. Some really hard work calling into play epidemiologists who look at patterns of disease in people, statisticians, God help us, who play a critical role figuring out were data analyzed the correct way. Very, very challenging field. So what do we know? First off, what do we know in humans about stress increasing the incidence of cancer? And this appears to be pretty straightforward, which is there is indeed an increased incidence of people with a stress history having a higher likelihood of coming down with cancer. And probably the stressor, the major stressor that's been studied most frequently, is major depression. And as we will see in a few lectures, you cannot begin to understand what's going on in depression outside the context of severe stress. So depression, other stressors, increasing the risk of cancer seems absolutely straightforward. From the cancer is due to stress to all the other ways in which people believe there's a connection, this appears to indeed be the case when you look at the data. But there's a problem. There's a problem that's already popped up in a number of these studies and a number of these disciplines that we've heard about, which is these studies are mostly retrospective. In other words, somebody comes down with cancer and you then find out what stressors did they have in their life. Or even more shaky, they come down with cancer and you ask them what stressors have they had in their life. And what we saw in the previous lecture is there's this problem. There's this problem which is when something bad is going on, our memory is preferentially focused on bad things. When something is awful as a cancer diagnosis is going on, and you ask people to say, well, have you had a lot of stress in your life in recent years? People will preferentially remember the bad stuff. And we saw that in the previous lecture, that wildly unlikely who approved this experiment where people were made to have chronic stomach problems experimentally. The doctor tells them, not truthfully, they've got an ulcer, or was anything stressful going on, and suddenly you remember all sorts of stressors. Retrospective data are very, very shaky for those reasons. Even retrospective, like going back through medical records. And what you see is when you look at cancer patients versus people without cancer, cancer patients remember more stressors prior in life when you control for did these two groups actually have the same amount of stress. Cancer patients, a higher rate of remembering stressors than non-cancer patients. Patients with severe cancer at a higher rate than people with less severe ones. Huge problems with this retrospective literature. So then we switch over to what's the gold standard of these sorts of studies, vastly more difficult, what are called prospective studies, which is you sit down with a bunch of people who don't have cancer, who, in order to qualify for these studies, in fact appear to be perfectly healthy, and now you follow them over the years and see if they come down with cancer. Prospective. You need vast numbers of people in these studies because the incidence of cancer in the time span of these studies tends to be rather low. You need an enormous amount of resources to do these studies. This is the gold standard, doing a prospective study. So when they are done, what has come out of that literature? Number of studies suggesting that, yes indeed, prospectively, lots of stressors in life increase the risk of cancer. But these studies often have some problems in them. For example, there's this one classic one that everybody learned about as this field first emerged, a study of a large number of people working in a Western Electric plant, I believe in Buffalo in New York, where a prospective study. And what they showed was focusing in on a classic stressor, as we've already heard, major depression. And what they showed was major depression, as you prospectively go through the study, major depression caused a twofold increase in cancer risk. Not good, seemingly an absolutely clear, irrefutable connection here between stressors and cancer risk. So that one's the iconic demonstration of it, the classic one, and some years after it was carried out, a very subtle, energetically detailed, focusing, statistically wise guy went and analyzed just the hell out of these data and discovered a very interesting confound in there, which was the people who were working in this Western Electric plant who were getting depressed were mostly getting depressed because they had an awful boss who had them working under unsafe working conditions with lots of exposure to carcinogens. Oh, well, that's kind of a confound. That's kind of hard to evaluate then. This classic study down the drain then in terms of showing a cancer connection. Okay, what else might come out of these prospective studies? You might ask, well, do people who have stressors, do you begin to see changes in immune function? What we know is changes, suppression of immune function in a way that now puts you more at risk for cancer. And in general, what these studies have shown is you don't get enormous decreases in immune function. Yes, in the last lecture we heard chronic stress, you can suppress immunity enough that you're now more at risk for a nose cold. Seemingly, the stressors that we think of as increasing the risk of cancer, they don't suppress the immune system anywhere far enough. Because the reality is you need to absolutely flatten the immune system to seriously increase your risk of cancer. And this is seen, for example, in HIV, people with AIDS, and one of the things you see is an increased risk of certain types of cancers, one called Kaposi sarcoma. This used to be a cancer you would see in 80-year-olds once in a career, and suddenly it's popping up in a lot of 30-year-olds with AIDS. Okay, severe immune suppression increases the risk of cancer. All things considered is the fact that the immune system is just ground down to nothing in HIV, and only a relatively small subset of AIDS patients come down with this cancer, making that same point again. You've got to absolutely push the immune system down to the floor, and on the simplest level, stressors just don't do that. So now we have a greatly weakened viewpoint of stress increasing the likelihood of getting cancer. Okay, how about a next realm of stress? How about the notion that certain personalities increase the risk of cancer? And this has been a wildly controversial field. There has been a long-standing view that there is a certain personality type that increases cancer risk, and these are individuals who are introverted and repressive, and especially repressive about anger, and minimal evidence for this. Minimal evidence, and one of the big problems is that that literature has relied very heavily on retrospective evidence. Furthermore, you see no evidence that these folks with these repressive, cancer-prone personalities have anything screwy about their immune systems. So in general, the literature showing a link between certain personality styles and cancer risk has been pretty unimpressive. Okay, so what we've seen now is there's not a ton of evidence for cancer, the likelihood of getting cancer, the incidence of cancer being stress-related. How about the next step in the progression? You've had cancer, there's been a successful treatment, the cancer has gone into remission. Does stress have anything to do with the likelihood of a relapse? The cancer coming out of remission, and what you see is minimal evidence at best. So now we move over to what in lots of ways is the most controversial issue in the field, which is not what does stress have to do with getting cancer, not does it have to do with a relapse, but what does stress have to do with the rate of progression, the rate at which the cancer grows, the rate at which things get worse. Can stress accelerate cancer progression? And this one is wildly controversial. Except, on first pass, it doesn't appear to be very controversial at all, in that there seems to be some fairly good evidence showing that stress can accelerate cancer progression. Now, the best evidence for that, the one that most caught sort of the public attention and seemed to just reify stress cancer, is to go in with a certain experimental style, which is intervene with cancer patients, do something or other that decreases their levels of stress, and does that slow down the cancer progression? And some studies have looked at this, and there is one classic one carried out by a colleague of mine at Stanford named David Spiegel, who did this study which was published in the late 80s, New England Journal of Medicine, and before it was over with, it was front page news all over the country. Here's what he did. Women who had just gotten a metastatic breast cancer diagnosis. And Spiegel had these women randomized into two different groups. First group got standard medical treatment for the cancer. Second group got standard medical treatment, plus they joined a cancer support group that had intensive group therapy a number of times a week. And when he broke the code, out came the finding that the women who went into the cancer support setting an average of 18 months longer survival than the other group. This was a huge finding. This was a dramatic effect. This was amazing news, and this was immensely exciting. And part of what was immensely exciting was it was absolutely clear how the underlying biology of this would work. And we've already heard this. Nice supportive group setting of therapy with other cancer patients make you feel less stressed. Thus, your immune system works better. Thus, you're better at fighting the cancer. Thus, you live 18 months longer on the average. Amazing finding, one that just had a huge impact in the field. So what has happened since then? Roughly half the studies that have been carried out since then support the finding, showing that supportive group therapy, various psychotherapeutic interventions slow down cancer progression. About half the studies haven't replicated it. So what's going on there in the cases where, yes, indeed, you are slowing down the cancer progression? What's going on there? Obvious sort of pathway again, better immune defenses thanks to less stress, all of that. Spiegel and his group have looked at whether there are indeed changes in immune function in women with these supportive settings. And there are some changes, but they don't particularly correlate with the cancer outcome. That's been less clear. So what's actually going on here? What's happening? And what we have here is something extraordinarily subtle and very tough to get at. And this is something where Spiegel has been one of the leading thinkers in this area. And this is a man who has a wonderfully sort of research integrity in terms of not getting pulled in by the easy explanations. What might actually be going on? And here we get into what is one of the dirty secrets in cancer therapeutics. Okay. You have cancer, and you're going through treatments, chemotherapy, radiation therapy. It is absolutely clear this is your best chance. Go through it, power through there. And it turns out an awful lot of people with types of cancer seriously diverge from what their treatment is supposed to be like. They are not as compliant as they are supposed to be. They fail to take their medications. They miss doctor's appointments. Something like a quarter of cancer patients seriously diverge from their treatment regime. Why is this a dirty secret in the field? It's obvious. You've got cancer. There's this whole sort of structure in the field, type C personality, people with cancer who are going to fight, and not let the cancer do them in. And if there's a treatment that might help, do it twice as much and just power through there. And suddenly, you got people with cancer who aren't taking their medications as much. Ooh, this looks really bad. Secret, dark secret, very rarely dealt with. Why does this happen? It's obvious why it happens, because most of the cancer treatments make you feel so sick and so awful that it's hard to comply entirely. So what happens in this cancer supportive therapy context? What you've got there is you're sitting around with a bunch of other people going through the same hell you're going through, and they all support each other. And they support each other in terms of compliance. Sitting there saying, did you take your meds today? I know I hate them too. They make me totally nauseous, but you know what? We're both going to take them right now. Have you eaten today? Yeah, I have no appetite either, but we are going to eat. Right after this, you are going to the doctor. You're not going to skip that appointment. When people are in that supportive setting of other cancer sufferers where they're cheering each other on, people become more compliant. And in lots of ways, this might be what's going on in this literature. And again, this is not a stress reduction, better immunity, less cancer. This is a completely roundabout way. What seems to have been one of the strongest links between stress and cancer, it's instead probably a compliance issue. Okay, so of all the classes, all the topics we've had so far, this is the one where I've probably spent the most time going after individual subject, going after it in detail. Why is this important? Why is this such an important topic to go after? Remember that 2001 study. Remember that one where the women with breast cancer asked to attribute their cancer to something or other, and the most common answer was stress. And somewhere in this urban legend, this folk psychology, somewhere in there with this erroneous connection between stress and cancer, something very dangerous and damaging occurs. Something which, frankly, there are all sorts of highly credentialed charlatans out there who take advantage of it. And we know this world, people who flog the notion that here's my brand of stress management, credit cards accepted, that will slow down the progression of your cancer, that will stop your cancer from growing, that will completely reverse it. And what we have here is very little, if any, scientific evidence linking this. And these are not crackpots off in the periphery. These are often some very influential and credentialed medical, biomedical experts. And there's one particular one I want to focus on. And I will bypass his name just out of sort of legalistic prudence here. But this is an individual, a Yale-trained physician, who in the late 1980s had a wildly successful best-selling book looking at this notion, advocating the notion that stress causes cancer, and thus stress reduction can slow down cancer progression. And just to be really careful about this, as I read some quotes from this man's book, I am going to actually have them here just so I get them right. Here are some of the quotes in thinking about the causes of disease, the causes of cancer. Quote number 1, the fundamental problem most patients face is an inability to love themselves. Next quote, she chose the path of life, and as she grew, her cancer shrank. Next quote, patient, I decided to live to be 100 and leave my troubles to God. I really could end the book here because this peace of mind can heal anything. In other words, if you have cancer and it's out of control and it's doing you in and it's killing you, why is that happening? Maybe because you're unable to love yourself, maybe because you didn't choose the path of life, maybe because you didn't grow in the face of adversity, maybe because you decided that you weren't going to leave your troubles to God, maybe because you really didn't want to live to be 100. All these attributions here, all these blaming the victim. And in lots of ways, this person's philosophy is most aptly summed up in, once again, a direct quote, and one of the sort of main ones in this book, quote, there are no incurable diseases, only incurable people. And what are you teaching someone when this is happening? You've got somebody on their deathbed with their terminal cancer that has resisted the treatments and progressed, and what this viewpoint teaches is, while you're lying on your deathbed, ooh, too bad I didn't have different priorities in life, too bad I didn't control my stress, too bad I didn't choose life, too bad I couldn't love myself sufficiently. This is where you wind up. Would it be so that these sort of interventions could cure cancer if only cancer could be stopped if we were sufficiently brave and sufficiently tenacious and sufficiently filled with love? It doesn't work that way. And this view being flogged by folks who are not crackpots out in left field, but again, often highly credentialed experts, the science simply isn't there. Amid all the diseases that we've had to think about in this course so far, all of these diseases where stress plays an adverse role, this is a domain where it doesn't count. And if you really push the view that it does, ultimately, bad science, bad medicine, ultimately bad ethics, and shame on anyone who would profit from this.